Welcome to Healing Through Dentistry podcast,
where we redefine health, wellness, and the power of your smile.
We're your hosts,
Hana
and Eva, twin sisters, qualified dentists and medical doctors.
This is more than a dental podcast.
It's a journey into profound connection between oral health and whole body healing.
Through personal stories, inspiring client transformations, and expert insights,
we explore how dentistry can ignite energy, relieve chronic pain, and transform lives.
Get ready to discover the extraordinary ways your smile can heal, inside and out.
Let's begin.
Hello and welcome to the next episode of Healing Through Dentistry. And today we are excited because we'd like to share our insights from a Swiss Dental Solution Congress or course, where there was one and only Dr. Joseph Choukroun, who is a French doctor. He is not a dentist. And he is the one behind the scenes and behind the invention of a technique we use to support our clients' healing. It's called PRF, or Platelet-Rich Fibrin, or some people call it plasma. And he is the one who realized it is really important to bring people the very little bricks from their very own body in order to build a big wall, or in order to repair a wall, meaning a body, or meaning a bone, meaning a gum, meaning a dental tissue. So we were excited to see him live for the first time, right, Eva?
Yes, it was fabulous. It was great. It was really outstanding. And I loved, and I'm grateful that I was able to be there. And the lecture was full of information, knowledge, data. And I have, even on deeper level, realized how the body is intelligent and can beautifully heal well only with the given material, which is our body.
Yeah. So I was actually quite surprised, or I didn't know where Dr. Choukroun is coming from. So he said he's originally from Morocco, right? So
Yeah.
he was using a lot of experience from Morocco as well. So as well as from France and like over the world, because he travels the world and lectures. He does that for decades. And he started his presentation with a claim, or with the sentence which was saying, wound healing is a natural mechanism. Who's in the charge? So if the wound healing is a natural mechanism, who can be in charge, right? And that was this capital BLOOD, blood. So I was actually, I just really like that beginning, because blood is what
The wealth
and the health. And it all comes to, maybe we're just going to jump straight to it, right, Eva? But like how the blood forms, like what you put in your body in order to support cells, not only the blood cells, but obviously the blood cells. And he was talking about that as well. He was quite funny as well, because he also said blood remains liquid for a life, which was quite funny, because he said like, well, if it's not a liquid, then you're in trouble, right? So it's kind of funny. And it was very engaging and entertaining to listen to him. So that was really, really good. But like you said, Eva, you said that you, even on a deeper level, realize how intelligent the body is, even though we're using his protocol since beginning and we see amazing results. It was like a very much omen, or it was like a very good signal for us that that's what we're doing and using as much as possible. Like he was always asking, like, how much PRV do you put there? As much as possible. And that's our theory. And so we're doing the protocol according to him. But I realized on a deeper level as well how important it is and how amazing the body is, and it can actually restore itself.
And I would like to just share a little bit of his life at the beginning, because I think that is important to know for the listeners. Where is he coming from? So he, as a student, he studied general medicine, and then he started as a surgeon, and he wanted to do the surgery that badly, but he was beginning with in a hospital, so he started suturing. So that's very important topic also in terms of the blood and PRF. But he said that he was doing also the surgery, neurosurgery, which is, again, you're dealing with lots about immunology. And then he settled and he was satisfied with pain, and he was a pain doctor. And I love that he shared his life a little bit, because you know where he is coming from and what he was dealing with. So, and as it is, the life brings you the right clients to grow. So he had a client who came with a very big defect of her legs. It looked like it was burned, but it was a systemic disease, lice disease. And she said, like, I'm coming for pain. I'm not coming, I know you can't do anything, but I would like to release the pain at least a little bit. And he tried for first time plasma or PRF. So he did use the blood and he placed it in a centrifuge. And then he used the beautiful plates, or, the pieces of concentrate on her skin. And in 4 days, he saw beautiful results. So that's how his journey started, and he started looking into it. And I think here today we would like to underline what is the most important in terms of the quality of PRF. And we would be talking about lifestyle, interestingly, not for us. Yeah, so we would be talking about how to prepare clients, or how to prepare ourselves for recovery, and what is important to do and what is important to have in our diet, in our lifestyle.
And meaning, Eva, how to get ready for a surgery, really, like not only for recovery, how to actually, in the first place, to get ready for a surgery. So it again all comes to preparation, getting ready for, like like I always say to our client, it is an Olympian achievement what we're trying to do here. Whether to grow the bone or kind of integrate ceramic implant, but it is a big achievement. And obviously, if the body doesn't have the right building blocks, then it can't heal, or it just takes long time, or there's complication, or the result is not what you would want it to, meaning the bone is not like big enough or strong enough. So I did like also with his presentation that it wasn't only about the immune system, but also about, the surgical techniques, which are very important to do, as well as using the PRF. But that would be a presentation for dentists, not for you. We don't want to get you bored. So it's going to be more talk.
More work for you, because we would be talking about lifestyle and about nutrition, about movement. And I loved that Dr. Choukroun, he was very strict, and I love that he's bringing protocol for all of us, not only dentists. He is bringing this to whole world. He was traveling from Brazil yesterday, so he is really all around the world.
And he was taking the Mickey out of us a lot of time, right? Like dentists. Evan maybe didn't get offended because we studied the general medicine, but no, I'm just joking. It is like a common perception that the dentist is side of the general medicine, which is wrong in our eyes. And it should, if it's the case in some countries, it should shift back. And that's what I believe we're living and trying to explain to our clients as well. Because you don't have a separate mouth where there's teeth and, you just kind of prepare them nicely, put veneers on top of them, and everything is nice and shiny. Like every single tooth is a living organ, and obviously, full of vessels, nerves, lymph, drainage. So obviously it's very, very important, and it leads to the rest of the body. So we know it's just going to be a side talk. If you listen to us, that we do stress the fact that every single tooth has a certain organ, has a certain endocrine gland, has a certain part of the body. It's the whole meridian, whole path through your body, which is connected together. So when there is an infection, abscess infection, a trigger in terms of metal amalgam filling, titanium implant, it triggers whole meridian, whole path. So everything on that meridian may be affected. And we see that in a surgery every day that it is the case. And also, like we see when those triggers are removed, how people benefit from it and how, the whole immune system just say, yes, thank you, because like a lid is lifted up and people can literally, some of them breathe better, some of them digest better, think more clear and things like that. So it is very important. Yeah, so maybe let's just say what the PRF is, or like what the blood is, or like what do we use and how do we, maybe people are interested in like what's going on, like what do you mean we take your blood and put it back into your mouth? So how does that work? So you were mentioning Eva centrifuge, which is like a special like device he invented, right? Dr. Choukroun. And
yeah, I would simplify for the audience or for anybody to explain to anybody. So simple way is when you are having any surgery in our clinic, we are looking into wound healing in holistic way. So we were looking for what we can add for the body to heal better. So whenever we are removing wisdom teeth or whenever we are removing root canal treated teeth in order to place a ceramic implant, we would be using the valuable blood of the client. But before that, that's a longer procedure, and that's what Dr. Choukroun he was stressing, that the clients they have to be prepared for this in terms of that they have the great quality of the blood.
And
Full
how
of
do you get prepared, Eva? Let me just jump in, because what's our like initial aim? What we want to achieve? We want to achieve, and I'm just going to use our term, dental term, is a primary hemostasis. What does that mean? We want to achieve that, the wound, which happens after the extraction, starts to heal, starts to close. That's the homeostasis. And how do we, and we want to, promote the healing. But how do we promote the healing? So one thing is that we can promote it. And now back to you, Eva, that people get ready. And how do they get ready? And maybe let me just finish my thought before I forget again. But then you can continue with how to get ready for any wound healing, that like to explain like what it is about the blood and how it can help us. So when we take the blood, so meaning like we really draw a blood, we put it in centrifuge, and the centrifuge makes it in that sense that it divides the certain really beneficial cells like in separate. And so it will create platelet-rich fibrin. So there's going to be a lot
concentrate of blood.
Concentrates, which is platelets and leukocytes, white cells and platelets. And the platelets and leukocytes, they do contain a lot of growth factors. And these growth factors are stimulating other stuff in order to do this hemostasis, to close the wound. And maybe that's what I wanted to just state to the start, that
It's a precious liquid, and especially the growth factors, that they are the ones who are behind that the gum heals as the gum, that the bone heals as the bone, that everything looks beautifully and like untouched at the end of the healing. So, and these factors, there are more than 150 growth factors, and always when we draw the blood, we tell clients, this is so beautiful. We have such a beautiful concentrate. We see the color, we see the shape of the concentrate, and we are able to say how much they were prepared for the surgery. So
and then
that's beautiful.
That's what you wanted to say. How do we say, and like
Yes.
what do they do before?
So how do you prepare in order for any surgery? I would say it's not an only dental procedure in our place, but we had clients who were getting ready for a heart surgery, for knee surgery. That's quite common. For any surgery you would undergo. So the first thing is nutrition, macronutrients, which is no gluten, no sugar, no alcohol, no seed oils, and no smoking, which I don't really say many times, but it's very important to say in here, because within blood clotting it's very important to say as well. So you are living this way at least 1 month before your treatment. and at least 1 month strictly after the treatment. You are following with a little bit looser arrangements afterwards. And you are as well adding towards these macronutrients, you're adding more protein, 2 grams per kilogram. So let's say if you are 60
Ideal
kilos,
weight, Eva.
ideal weight,
Always
ideal
important
weight.
to just set a 2 grams for ideal weight, because some people obviously are overweight and some people are underweight. So it is actually based on like your ideal weight, 2 grams per kilo.
Yes. So you would be having 120 grams of protein per day if your ideal weight would be 60. And that would mean for breakfast, 3 eggs, a piece of cheese, and a vegetable, So this is one part. But the essential part, which not everybody, we're not used to do it, is supplementation. And that's the key, because you would like to have the plasma, the concentrate rich of nutrients for healing or in order to develop these growth factors. So there is a protocol again for 2 months, 1 month before treatment and 1 month after treatment. It's quite in length. And then at least 6 months later, we do big fives. Big five is vitamin D3, K2, magnesium, vitamin C, and omega 3. So this is how you get ready. But I have to say that I loved the data behind, and we would explain why. Because why do we want vitamin D? So the growth factors, they only can be created, or the body is able to create the growth factors if there is vitamin D, because we know, and I'm grateful actually for COVID era, because there was so much research about nutrients, vitamins, and especially vitamin D. So vitamin D is not only has an endocrine function, which it's a hormone, but also very much immunity, immunopotent effect on a body. So anybody who comes through my door, I never forget to notice, if you don't take anything, at least vitamin D3, K2, please just start taking.
And magnesium, right? That needs to be taken so the D actually gets into your body. So it's like a sacred trio.
Yeah. So, well, we have the goodies in the clinic. We use soups from Dr. Dome. So he has bone and teeth, which is like full of all the friends for vitamin D3. So Husky is here. So she's only saying hi. So, and we will continue.
Just maybe jump in and just maybe add on the vitamin D, because Dr. Choukroun was just saying only on its own vitamin D would make a big difference. And he said why? Because he supports a growth factor which is called nuclear related factor 2. So I remembered 2 of them because they're like 150, but this one's quite important in order to accelerate all of the tissue healing. And also,
because he's standing behind the differentiations of the cells.
Right.
So they differentiate into bone cells, into gum cells. So yeah, it's very important. And the D is the key.
Exactly.
Otherwise, it would not happen. So we have conditions when it does not happen, and it's a condition when you take some medication. But yes, so that's essential to take vitamin D.
Yeah. And I think it's very important just to say, like, in a maybe less complicated way, that we basically want to get the body ready and we want as many good stuff for it as possible. So meaning, in our words, like medical words, as many antioxidants as possible. What's antioxidant? Yeah, it's a molecule which, provides the electron which is missing when there is a free radical, right? But meaning, like, what it is the spinach, it is the vitamin D, it is that we exercise. So there's always like this imaginatory way when we obviously want ideally balance, or we want the scale to be lifted up towards the antioxidants, because they always fight against the free radicals, the oxidants, the oxidative stress, so-called. So and which is not only caused by the way what we eat, but also like, you know, your body is 24/7 repairing something. Either it is, you know, your muscles or your body after a run, after a stressful night driving, after a stressful night, I don't know, drinking alcohol or whatever, party. So that's the free radicals versus antioxidant. And like that's why Eva's just so big, or we're so big on vitamin D, because then on its own, even if you don't take anything, well, obviously you need to take at least those three, like D3K2 together, magnesium, zinc ideally as well. So everything builds into the cells nicely. But it is kind of almost like the headmaster, right? Vitamin D. It's like that king of vitamins in my eyes.
Yeah. And even clients, they ask whether the kids, they should be taking it, you know, everybody. And the very easy rule is if you're 1 year old, you take 1,000 units. So ideally, I love to take it in a liquid, in oil. So for 2 year old, it's 2, and so on and so on. And Dr. Choukroun, he said for rest of your life, for reparation, for that regeneration time, you would increase it into 10,000, 20,000, sometimes 30,000 per day. But for the rest of your life, he is saying that 4,000, 5,000 is very important to take to take vitamin D3 for the rest of the life, because the metabolisms, again, the way that you have to take it every day, it's just how the vitamin D3 is incorporated and how it works.
And so, Eva, why don't we just like finish with this vitamin D, and then maybe in the next episode we can talk about the physical exercise and, you know, lipids and other, you know, like blood markers.
Yeah, no, I think we can just finish this episode in here and say to our audience that in the next episode we would be talking about what tests are important. So how do I know if I am ready for the surgery? So I would finish this way. Thanks for listening, and see you in the next episode.
We can't wait to see you in the next episode. Have a good day.
Thank you for joining us on Healing Through Dentistry podcast.
We hope today's conversation has inspired you to see your smile as the gateway to whole body well-being.
To stay connected, visit us on our website or follow us on social media.
If you enjoyed this episode, please subscribe, leave a review, and share it with someone who could benefit.
Until next time, remember, healing starts with a smile.
Take care,
and we will see you in the next episode.